is WZRD Chicago 88.3 FM. And we have with us at WZRD via Zoom, Scott Wajda, President of the Client Advisory Council at Trilogy Behavioral Healthcare. And we are going to discuss National Recovery Month. Hi, Scott. How are you?
Good. Thank you for having me here.
You're welcome. Thank you for joining us. So how is Trilogy Behavioral Healthcare observing National Recovery Month?
Well, with the, as far as I know, with the COVID, they're not, they don't have anything like big planned or anything like that. Like normally in September, we would have our health fair where our clients would come down and we'd have basically a fair out in our parking lot at 1400. And then we'd have different stations for clients to visit,
Oh.
That would normally be going on, but because of COVID, it's not,
Yeah. So you would have vendors and information resources for the community for the at the health fair if you were to have it.
Yes.
Before.
Yeah. It would be from for the clients. Basically, we have nurses from Rush University help out the clinic there at Undercarton Clinic. So they have their stations, and everybody can run through their stations, and then we have other stations from the clinic, and also other types of wellness tools that they can take advantage of that they might not know about, So
it was only for the clients, not for members of the public then?
No.
Right. So is there anything that's going on virtually for the clients? How are their computer skills, the clients? Do you have classes to help them?
We do have in our drop-in center, we do have 8 computers that clients can utilize. Computer classes, no, we've not that I know of that we've had. I haven't been in groups for a while, but I do know that I've seen recovery counselors with clients in the beacon at the computers so there's some one-on-one instruction there, and I'm sure that the employment services they would also instruct clients on how to build a resume and and maintain that resume and stuff like that. So in job search, with the computers,
Nice. So are the computers usually well utilized? Eight computers for about how many clients that you have right now in Trilogy?
Oh well, I think we have about 2,500 clients. Now that's throughout the entire city of Chicago, Evanston, and Skokie. So approximately, I'm going to say 500 of those clients probably go through the beacon, on a weekly basis. I'm going to say that. I'm not so sure of the number though, but
that's okay.
There seems to be enough time for each client to be in the computer that wants to be, all clients want to be in a computer, now we do need we do have a need, I guess, for a drop-in center on the south side, by Lawndale, where our old drop-in center was down on Lawndale, or in Lawndale, I should say. And that drop-ins, we used to have one. So that drop-in center used to have computers and and things that clients could do from that area of the city, but unfortunately we don't have that drop-in center any longer, but we are looking for property, I guess, there
Mhm.
Trilogy could utilize, so.
So the Beacon is the activity room. Is it called the Beacon too at all the Trilogy behavioral healthcare centers?
Well, no, because the 1400 location right now is the only one that clients can access.
Mhm.
All the other locations are just like staff offices,
Mhm.
closer to the clients that they visit, or they help with med packing, taking the doctor's appointments, things like that. So those offices are primarily for staff to be closer to the clients that they serve.
Mhm.
So I mean, that's why we would want a drop-in center on the south side, and they're looking at property and things like that to hopefully acquire one. So
Are there any clients that reside in Trilogy, or are they all walk-ins and they live around the neighborhood?
yeah, they live in the neighborhood. Trilogy is basically an office. For
Mhm.
locations in office where they have the Heartland Clinic, they have the Beacon, they have I think I know recovery services team is there. There's 2 CST teams. I think there's 1 ACT team that's stationed there for the north side. And then the other offices that Trilogy has also have those teams in those locations, like in and I can't remember. I can't now, it's escaping my mind. But
Okay.
down south of the loop, there are other offices that Trilogy has for staff to go out and visit clients. There is a location on the South Shore that houses clients, but it's very small. It's not very large at all, I guess. But there are those units, residential units and offices below them for the staff. So
CST, what does that stand for?
community support team.
And are they funded by Trilogy, or is it funded by the city?
Well, Trilogy bills for its services to the Medicaid. So it's basically from Medicaid, or the state of Illinois. So they do Trilogy does receive grants from the state and federal government.
Mhm.
So they do also do that. So yeah, I mean, there are probably some city grants in there as well. I would imagine. I mean, they try to maintain with as many funding resources as they can. So.
Of course, of course. So are there any activities for National Recovery Month? Anything at all that the Trilogy is doing or has done over the past month? Anything special for just to for this month?
Uh,
Even outreach, anything.
no, not that, and again, not that no, I don't think so. Not that I've heard. I think they're trying. There's in a sense they're trying to keep a low profile. I think because of the COVID.
Of course.
So I mean, it's not that the clients don't want, like, usually we would have a Labor Day picnic.
Mhm.
We couldn't do that this year.
Right.
We couldn't have our Memorial Day picnic, like we usually have. One thing that's coming up though is the Trilogy's Gala, which is October 21st. That's also the 50th anniversary. That's when they're going to be celebrating the 50th anniversary of Trilogy as a behavioral health service.
Mhm, mhm.
And
Is that going to be an in-person gala or
no,
virtual?
it's going to be virtual. There
Mhm.
might be a I'm trying to find it here on my computer. Yeah, mostly it's going to be virtual, and mostly it's going to be maybe some recordings, things like that, of clients that have benefited from Trilogy services,
Mhm.
and some staff members who have worked at Trilogy, their thoughts on Trilogy and what they think about it. So,
Mhm. Do you know how successful the employment program is for Trilogy?
well, I think they did win an award for that. I mean, for their program, but I'm sorry.
That's okay.
Um, but I do know that they, it's one of the things that, I mean, they're always job developing. I mean, they're always going out and trying to find employers, that are willing to work with Trilogy clients. And then the success of the program depends on, the clients as well. So they're willing to work, but are they able, are they willing to follow, I guess, instructions, or advice that they would get from their employment specialists, as well as their employers, and, so it goes both ways. So.
Is it hard for the clients to follow the advice, or how successful do you know of clients staying at their new place of employment?
Well, it would be more difficult without the employment specialist there.
Mhm.
But and again, it depends on all client willingness, and yeah, client willingness. And
Mhm.
but then even before that, how willing are they to, engage in recovery,
Mhm.
in with their recovery counselor and their employment specialist, and stuff like that. They have to be willing to engage in that way. And so, and how do they handle things that come up at work, and, are they willing to tell the employment specialist those things? And, you know,
Mhm. Of course.
you
Is
know,
um is finding a job part of the recovery treatment, or is it the client that takes the first step in asking for help to find a job?
the client task,
Mhm.
that first step, because I get it, they have to be willing to do it, you know.
Mhm.
Yeah, I mean, it's not that the recovery counselor don't ask, hey, we have this employment service, are you interested? And they have to say yes. I mean, that's first step in being successful at anything, is wanting to do it, so so yeah, they take the first step,
Does a Trilogy have job training, different parts of just skills, job skills, etc.?
Not No, I don't think hands-on training or anything like that. I think they're getting most of that through the employment specialist, and they sit down at least once a week with the employment specialists, discuss on the job, before they get the job, it's how do you get a job? Your resume, your interview skills, your, you know, uh, and going out and visiting potential employers. So after they get the job, it's what comes up during the job or on the job, how are you handling that? You know, um, and then the employment specialist will give them options and what they can do or say, or, how to perform their job maybe, so they can be successful.
Mhm. Yes. So there is support. Let's say there's something going on at the job that is very hard to deal with. Then the client is able to ask the employment specialist for help in addressing that issue.
Yes. Yes.
And uh, what kind of do you know what kind of jobs are best suited for the clients, or is it a wide range?
Well, I mean, they're people, just they're human, like every other human. I mean, they have it doesn't really, I think that the degree of their mental illness would maybe maybe limit them in some way,
Mhm.
to a job perhaps, but I mean, but again, there's probably, you'd have to get to the job, or or be presented, like they would be presented with a job and see if they like it or not,
Mhm.
and maybe the employment specialist will describe it, to them, see if they want to do it or not, I mean, right now, I work at Albany Care, and I basically I provide information for the residents that work there, that live there,
Mhm.
and I do talk to them. I do, give them my experience and things like that. And it's something that I can do is a low stress, type job for myself, so I mean, and some of it's, so I do that. But again, some of it's trial and error. It's like, a client may start a job, decide they don't like it, maybe go to another one,
Mhm.
and a different type job, and see if they like that, so.
Mhm. Well, that's good. That's the way it is. A person being a client or not. So
Yeah.
that's normal. When they are so the clients come with different sets of skills or different kinds of interests. So uh, could the clients tell the employment specialist that this is what I really love to do, and then would the employment specialist try to find something that might interest them, and then help them actually find an opening?
Yeah, yeah, for sure. Yeah, I mean, not you mean, I mean, the mental, people get sick, clients get sick at all different stages of life. Okay, and some people were like fully employed before
Right,
they became sick. You know,
right. Mhm.
um, so they can do a job similar to the one they were doing before, perhaps.
Right. Mhm.
So and they also know if they've had if they got sick and they've been in recovery for a while, they have an idea themselves of their limitations and what they can do, and how, which job they're going to be successful at, or what type job they're going to be successful at.
Mhm. So when you provide resources at Albany Care, is it so it's resources for employment, and what other resources do you help the clients with?
Um, like telling them that, telling them that there's a public library downtown, and there's a lot of resources they can get at the public library. Or taking them to the Annexer Center, which is in the Gateway Shopping Plaza. On Saturdays I take some clients to church at St. Nicholas Parish. You know, um, uh, or restrict, or the other thing that I'm utilized for is taking restricted residents to Main Foods, which is a block down the street from Trilogy, but because they're on restriction, they can't go themselves. So I take them and they get whatever they want and we come back,
Mhm.
There's people that are on quarantine, maybe they just got the Trilogy or they just got back from the hospital. So they're on a 14-day quarantine and they can't leave the building under any circumstances. So if they need something from Main Foods, then, they tell me what it is, they give me a list and then I go get it and, bring it back for them, so stuff like that,
Mhm. Mhm. So the quarantine at Albany Care, then, right?
Mhm.
Okay, and that's more of a medical office, or is it a recovery office, or both?
No, it's a facility for the mentally ill, okay,
Mhm.
residential facility, okay.
Mhm.
There are medical officers there. They do have doctors that come in and will see residents. You know,
Mhm.
they they do have a nurse dedicated to the medical office that handles the schedule of when residents see doctors.
Mhm.
Like that.
How is Albany Care connected with the Trilogy behavioral health care?
They're not.
Mm.
Other than being a facility that treats the mentally ill.
Oh, okay. So
You
no
know,
collaborations or anything. Mhm.
no, no.
Okay. How involved are families in helping clients recover usually? Or is it so it's so varied that it varies from individual to individual?
Yeah, it definitely varies. To the level of involvement, some families just don't understand it and maybe don't want to, you know. And you only have one person in a family that kind of understands it. My brother, he somewhat understands it. I did sign a release form, information release form for him to be able to talk to my recovery counselor. So if there's any emergency or anything like that with me, he can, or if he has a question or concern, he can always call my recovery counselor and talk to her. Now, in like 3 years ago, I think, I let him, he came to visit me, and I let him sit down and talk with my recovery counselor for an hour,
Mhm.
and I was off doing something else, but uh, yeah, I feel in my recovery that I need to be open and honest and transparent, and I wanted my brother, since I selected my brother as my contact person, um, that I wanted him to be able to ask whatever questions he wanted to ask, of my recovery counselor. Yeah.
Mhm. So do clients are they when they recover, are they able to just not have to come back? Are there many clients that are so recovered that that the Trilogy Behavioral Healthcare has helped them to completely recover and they could go back and function in normal life?
Um, I I believe that let me say this. I realize that I have been diagnosed with major depressive disorder. Okay. So, and I know my major depressive disorder is going to be with me all my life. Okay.
Mhm.
Um, how I handle it, how I utilize the resources that I have right now, and is going to determine how well I can function in the world. Okay. Um,
Mhm.
there are other circumstances, family circumstances, meaning yeah, trauma is a big one, but also how people were raised in their families, how dysfunctional or did their parents have addictions, that's all going to play into if that person can function normally, normally, I should say,
Right.
in in the world,
Mhm.
and how long they're going to be hooked into services, because different family systems and different trauma are going to affect, um, how long someone's going to stay on medication, and also the degree of mental illness, what type of mental illness do they have, okay, that's also going to determine how long they have services or if they have services for the rest of their life, you know, and again, willingness, is the client willing, to seek outside support outside Trilogy, because some people, we need to do that, or are they stuck with Trilogy? All they want to do to meet with the recovery council once a week, med pack, and that's it, or do they want to participate in groups, do do they want to socialize outside Trilogy, you know and all that also determines, how long they're going to be with services.
So do you find that clients that prefer group services and interaction, do they seem to recover faster than those who find it hard to interact with groups?
Yes. Yeah, they have a better chance, to recover than, and when you say it, I think it's, I don't know if that's a recovery is like a buzzword, I think, but I don't know if the recovery, maybe recovery is a better word, because I don't know. Like I said, I know that, major depression is going to be with me all my life, how I handle it, what do I do with it, is going to determine, how well I function, so so yeah, the clients that interact will have a better chance to maintain a higher level of recovery, I should say.
Mhm. So in other words, you're saying that it's really hard to completely recover. It's more of being able to control what is happening so that um, uh, a patient is able to function more normally in society.
Yeah, it's how do you manage your symptoms?
Mhm.
What your symptoms are. I was a nominee ambassador for like 30 years. And I went to nursing homes to talk to people about moving out, like I did, and I ran into a woman who, had just come into a nursing home, and she had been there a few months, and she wanted to move out again. And I was talking to her, and she goes, well, I had my own apartment and all this, but my team, and she had a team, a service that was helping her in her apartment. Um, and so I'm talking to her, and she had no idea what her symptoms were. None whatsoever. I mean, she didn't know, what to look for, or and the more I talked to her, the more I realized that she did not like her team at all. And so there was a resistance, also from her, to from the people that were trying to help her. They're
Mhm.
the people that we're trying to help, I should say. So I mean, that's also gonna, play into, are they going to recover or not? Are they going to engage in recovery, I should say? If they don't like their team, if they have if they, and some of that is from their past, circumstances they've had in their past, trauma they've had in their past, the family they grew up in their past, and how those interactions shape, how they view the world today, which really, I mean, kind of goes for anybody, really. I mean, anybody can have trauma and addiction in their past, or, addictive parents, or, whatever, it's all going to shape how they view the world now, their reality at this moment, and it's their decision to determine how am I going to, how am I going to react, or how am I going to will I choose to overcome this, or work on it, or seek resources, to do it. I mean, that kind of goes for everybody, I think. And I think that, but people with mental illness, it's a little bit more difficult, depending on their mental illness and what diagnosis they have, but it's a little more difficult for them than someone who has none, and someone who doesn't have support, like, I have support at Trilogy, and I have a recovery counselor, I have a therapist, so I decided, when I was moving out of Albany Care, that I was going to accept help from other people,
This is WZRD Chicago 88.3 FM, and we have with us at Wizard as we continue our interview with Scott Wajda, President of the Client Advisory Council at Trilogy Behavioral Healthcare. You still are President of the Client Advisory Council, right, Scott?
Yes.
Okay.
Yes.
When you mentioned that you were a counselor at Albany Care, what kind of counselor? It kind of you spoke a little bit too fast. I didn't catch what kind of counselor.
My official title is peer support specialist. So I, and it's not a counselor type role. I'm mostly an assistant to the social workers that work there.
Yes.
And like I said, I'll go out, I'll take people out to the store that are on restriction. I'll take people for walks, take people out for smoke breaks, when they're off smoke breaks, and I provide, I'll provide resources for them from the library. Like I was just at the library on Sunday, so I grabbed a lot of literature and things like that I'll be able to hand out when I'm there, at Albany. And basically, and I talk to them too, whereas some of the social workers, well, I should say all the social workers are very busy. They don't, there's only, right now there's 7, I think, for the entire population there. And they're busy, doing the things they need to do for each resident, and they don't have the time to talk, just sit down and talk to residents, and I do, because I'm not a social worker. I don't do their job. I do other things. And one of the things I do is talk to people, and, let them talk and be heard,
Absolutely, yes, because we know that the social workers have a lot of paperwork, and if they have that many clients, they've got their hands full. They need someone like you to help them. What about at the Trilogy? How many social workers does Trilogy have at their facility and Greenwich?
No, at Greenleaf, well, if there's, I guess if they're fully staffed, they're probably at least, yeah, there's gonna be probably seven social workers per team. And there's for two, three. If there's 5 teams there, then that's 35 social workers. My numbers can be off.
No problem.
But that's the social workers, and then you're not counting the support staff that are there, the clinical directors that have offices there, and then it's their headquarters, so they have the administrative staff that's also there.
Do they have any peer support specialists at the Trilogy as well?
Oh yes, they do. They do hire peer support specialists.
Well, what you're doing as president of the Client Advisory Council, that is a little bit like what you're doing as a peer support specialist, because the clients come to you with their concerns, and then you try to help find a solution or speak with the administration.
Yes. So yeah, there's a similarity there. Yes, for sure. Yeah.
But I guess you don't get paid for being the president of the Client Advisory Council. That's more of a client formed group, or is it a group that was organized by Trilogy?
No, it's organized by Trilogy.
It is.
Yeah, they want they want the clients to have a voice, and the clients have a voice through the council.
Yes.
And we get we get enough support from them, from to help us with our what we want to do. Like in August, we actually had a in-person meeting in August for the council in the parking lot, because we can't meet in they have our normal meeting room in Trilogy is spaced off for only 10 people, and so more than 10 people on the council, so including staff that are with us at our meetings. So they set up an area of the parking lot where we could meet in August. So, which was nice, be able to meet in person like that, so.
Right. Yeah, that's the only way to meet. You can't use the beacon room. Even, yes, even mask is not enough, yes, understandable. So recently, that Chicago closed down a lot of mental health offices. So how did that affect the people coming into a Trilogy? Is Trilogy able to handle all that overflow?
Are you saying that did the city of Chicago close down mental health facilities recently?
I think it was like in the last maybe 5 years or so. They closed most of them. That's what I heard, that they privatized. There were like maybe at least 15 before, and now there are 5 or less or fewer than 5, something like that.
Okay. Well, I do know since I joined Trilogy in February 2013. Okay, and I know since then that Trilogy has grown more bigger than they were then. Okay, putting up a lot of staff offices around the city. A lot of the offices, well, actually, all of the offices that they open within the city, staff offices they've opened within the city have been since 2013, and they have grown much. I mean, speaking well, but yeah, they have grown since 2013 for sure. 2013 they were limited to, they were only at 1,400. Okay, and now they have offices all over the city. yeah, I guess in that yeah, I think they've taken in that overflow quite well.
Mm, yeah. So I know that the city privatized some of the mental health facilities. Did they? Do you know if the city is has contracted with Trilogy for any of the recovery work?
I I don't know that.
That's okay. No, that's okay. That's fine. That's fine. Okay. So let's remember last time we interviewed, then we did a community assessment, and then let's see if your thoughts have changed from that time. Let me just do a little refresher. Uh, WZRD Chicago, being a nonprofit radio station, must be responsible to the community we serve. WZRD is mandated to file quarterly issues with the FCC on non-entertainment community-focused programming. We like to assess the community for these quarterly issue topics with 3 questions. First, what is most important to you?
To me personally, is it to continue my recovery.
Mhm.
You know, in like I said before, it's my decision on how well my recovery goes, basically. How willing I am to engage in uh, therapy and the services that Trilogy offers. You know, um, it's I'll say in my case, there's a lot of I grew up. I did grow up. I had a lot of fear in my life. And basically, I live my life in fear. Most of my life, and Trilogy's really helped in that. I mean, my decision to engage with Trilogy really helped with that.
Mhm.
And then when I got there, and their support was great. How long am I going to be with services? I don't know. Yeah.
So you're taking medications, you just have to keep on taking the medications? Or
Yeah, I probably will be taking medications. I believe for the rest of my life. That's what I know now. That's what I know now. You know, and how willing am I to engage with the outside world, and so.
so when you arrived at Trilogy, you weren't as uh, able to engage with others as you are now. So it's the Trilogy that helped you be who you are, how you're being like a peer specialist and helping clients have a voice.
Yeah. The first thing was my decision, allow others to help me. Okay. And then listening to them and engaging with them and signing up for groups, and then after a while being able to share in those groups, and talk about what was going on with myself.
What do you mean sign in with groups? Were there different groups for different interests, or is it just like maybe a certain amount of a certain number of people could comprise a group, so that if there are a lot of people, then there are a lot of groups?
No, there's the different topics, like depression management, anxiety management, bipolar disorder, PTSD disorder, and how it goes along with mental illnesses and trauma, that people experience. Um, in I mean, they also have like a music group, where they have a topic like maybe guilt, maybe, or anxiety. And then so each member of the group or each client could pick out a song they know that kind of speaks to anxiety, right? And then they can play a song. They play only like 3 minutes of the song. Excuse me. They play 3 minutes of the song, and then the other group members can then the person who suggested that song talks about how that song affects them with anxiety, and then the other group members can also share about how that song would affect them with anxiety. You know.
Speaking of, yeah, which, I heard before about music therapy. So is there any music therapy in Trilogy?
Well, I guess that would be the music therapy. They call it, the group is called Rhythm and Recovery.
Rhythm and recovery, that's nice.
Yeah, so they have that group there. Actually, they had to expand it. People really liked it. So when I was attending groups, they had just one for like a couple group cycles, but they had expanded it like up to like 3 groups at 3 different times, so that people really liked the group. So, and they were telling other clients about the group, so they wanted to experience it themselves, so.
Do you know when the group started? Just kind of like that frame of mind to see when people appreciated how music could help.
Maybe, yeah, I'm thinking like a year after I got there, perhaps. So like 7 years ago,
Yeah, 2014.
Yeah, something like that. Yeah. So.
Nice. Okay, so continuing with the community assessment, what long-term problem do you feel that we must address?
Long-term problem, stigma. Not that it's always going to be there, but it's something that needs to be worked on, not only with clients, and as I said before, clients with how they approach their recovery, or they engage with recovery, but also with staff in how they engage with their clients, and things like that, and then the community, community education on people with mental illness and how they look at them, and view in the community. Then, if we go up into politicians, the legislatures, and their stigma on mental illness and their funding that they that could go to these agencies, and being able to see the need of people with mental illness and how they can impact a life by funding these agencies. And also with even in the community, with community stigma, again, donors, private donors, and that's all that, like Trudy's 50th anniversary gala that is on October 21st. That's going to be a place where they're going to want a lot. They're going to get private donations, and they're wanting to people to give from the community to them.
Did you say from the community, or did you say food from the community? Which
from the
from the
community.
community. Got it.
Yeah, so, yeah, I mean, it's going to be it's going to be on the internet, so it's going to be worldwide, I guess. So hopefully they'll get donations from places maybe they didn't think about before, or people that never knew about Trilogy. Maybe they'll get some donations that way. But I think that if there's going to be a greater chance of recovery, okay, a greater chance for people to engage in a recovery, okay, then I think the community has to be more involved in engaging with mentally ill people. I'm not sure how that looks, I'm not, but I think that would be important, not in the acceptance of people with lived experience with mental illness, but also that the community members would be more apt to donate, I guess, what they can, and not have to. So the agencies would not have to depend on the government, for funding.
And Trilogy is a 501c3, right? They're not, or are they a private organization?
I think, no, they're a nonprofit. Yeah.
They are a nonprofit.
Yeah. So
Yes.
I don't know what number they are. Or
oh, that's okay.
But I do know that they're nonprofit. Yes.
Mm-hmm. Right. What problem must be resolved now? We were talking about the long-term problems, but what problem needs to be resolved now?
Well, I don't. Okay. It would be really nice if, yeah, I understand that COVID is here. There are vaccines available. Okay. They have not been as fully tested as other vaccines in the past, but it would be really nice if people would get vaccinated, because and one of the issues right now at the Beacon for Trilogy is that a lot of clients have not become vaccinated. We only have about 40% that have, and it is not that there's not a lot of information out there. I mean, to help them decide if they want to get a vaccine. I've been vaccinated. I got the Moderna, and I know other Curly clients that have been vaccinated. But so one of the issues is that the Beacon is only open to 10 people at a time at the moment. Okay. And that's because of client vaccination status. Only 40%. So they don't want to mix non-vaccinated with vaccinated in the off chance that somebody would get sick, Now, people with lived experience, the majority of them have underlying health conditions, okay, that if they were to get COVID, it would be more severe for them, than someone who doesn't have any underlying conditions. Okay. Mm-hmm. So that's why Trilogy is being so cautious with like picnics or large gatherings or things like that, So yeah, so if more clients became vaccinated, if we can get up to a high percentage of clients being vaccinated, then I believe that they would ease the restrictions on the beacon to allow it to open to more
Mhm.
at one time.
What about at Albany Care? Is the vaccination rate over there comparable to what it is at Trilogy?
No, because they have doctors and nurses right there. And all the people live there at Albany. Okay.
Mhm.
So they had a full in there, and because they're a nursing facility, they were mandated by the state to push vaccinations. Okay, so
Mhm.
for over 95% have been vaccinated at Albany. You
Mhm.
know, so
Does Trilogy offer in-house vaccinations and testing?
yes, at the Heartland Clinic, that's attached to 1400. Clients can walk in. Actually, I asked this a couple weeks ago, and I didn't I didn't post it. I'm sorry, but they told me that anyone from like Rogers Park could walk into the clinic and get a vaccination, get a Johnson & Johnson one-shot vaccination. Uh, it's a walk-in clinic. It's you don't have to make an appointment, and there's no need to make an appointment for a second shot because it's a Johnson & Johnson one-shot vaccination.
Mhm.
And I can I will post those into Rogers Park News, the hours,
Yes.
that people can do that. I just didn't do it. I'm sorry.
That's okay. Later, maybe.
Yeah. So we've been putting out flyers to clients at least to come and get vaccinated.
Well,
Yeah.
if you have a digital file, then that would be perfect for social media posting.
Oh yeah, sure. Yeah.
Mm.
And so I did um and I think that no, I heard that the but a few months ago, before we started handing out the flyers, um I think they were at like 25% vaccinated.
Yeah, well, so then it did help, even though it's only 40%,
Right.
it's still better than what it was before.
Right.
Mhm. Let's see. How is Heartland Clinic connected with the Trilogy? So there is a space that's specific for Heartland Clinic at the Greenleaf location?
Yes.
Oh,
There's a full clinic there. Yes. Yeah.
when did it start? We did realize that there was one over there.
Um, it was there before I got there, so I
Oh,
know exactly when they did that partnership.
that's no problem. Mhm.
I don't know, but it was there when I got there in February 2013. You know,
And Heartland Clinic is also a 501c3, right? A nonprofit at least.
I believe so. Yes.
Mhm. Well, is there anything else that you would like to share with us about National Recovery Month or anything else about Trilogy or your work, Scott, before we sign off?
Uh, um, no, just well, I guess I would ask everybody to just have an open mind about everything, and there's a lot of stuff, a lot of things just going on in our country right now, and um, just have an open mind, just accept people for who they are, where they are in life. Um, you know, Not only will that acceptance of people, of who people are and where they are in life, uh, you know, bring a sort of peace and serenity to just, people, but yourself as well, and I know that since I've been doing that, that my peace and serenity and my joy have been on a high level. So.
Well, National Recovery Month, the message is also for people to understand that there are those who are trying to recover, and that it would be good for them to support others in their recovery. Or is that the message of a National Recovery Month?
Yes, I believe so. Yes, but I mean, you can. I mean, yeah. I mean, it's targeted enough for that, but I mean, on a larger scale. I mean, just if this, if people just, if talking about Recovery Month, if you accepted people who for the people who lived the experiences for who they are and where they are in life, and understood them, and maybe not understand them, but just accept them, accept, and just like radical acceptance or blind acceptance of someone, instead of judging them on how they look, or how they, maybe they might be, a person who lived experience, or they might be, they're acting funny or whatever. Just accept it, and just accept it. They're human, just like you, and so, and and like I said, it would lessen. It has lessened my stress, and my anxiety, just by accepting everybody in this world, for who they are and where they are in life,
And that's a message for throughout the year, not only during National Recovery Month, to be accepting. Okay. Well, thank you so much, Scott Wajda, President of the Client Advisory Council at Trilogy Behavioral Healthcare, for joining us again at WZRD and sharing more about how important it is to support people and their struggle toward recovery. Thank you, Scott.
You're welcome. Thank you for having me on.
Thank you.